Right, for more coverage of the local COVID-19 situation as we begin our third week of life with COVID-19, I have Kim Yeon-SEUNG back here in the studio. Yeon-SEUNG, welcome back.
Feels great to be back, Sunny.
Right, let's begin with the government's response then to the current resurgence here on the local front.
Right. Well, as Sohan mentioned earlier, we are seeing an increase in critical cases across the nation, and health authorities have said earlier that they might hold off on the further easing of restrictions if the country sees more than 500 critical cases daily, because a tally over that threshold could potentially overwhelm the country's healthcare system. And as you know, it's concerning because the current trend does show the country might not be too far from reaching that mark. Seoul and Incheon both have 75% of their ICU beds filled, and almost 60% of ICU beds are occupied nationwide. Of course, health authorities still need to take time to fully assess the magnitude of the situation. They said earlier today that they're going to take into account all aspects of our circumstances before they make the decision to apply a circuit breaker. They're going to first look if it's possible to expand our medical capacity, whether they could acquire more medical beds and ICU units, and then assess where the infections are most likely to occur. And then they're going to strengthen prevention measures specifically in those areas. So this might actually include expanding vaccine passes or lowering the cap on social gatherings depending on the situation. They're going to announce the entirety of this contingency plan, and it will entail all the specific guidelines on the types of measures the nation will take in certain situations.
Right, and the announcement itself, Yeon-SEUNG, will be made on Tuesday then?
Yes, it will.
Right. But meanwhile then, what's happening on the vaccination front?
Right. Well, starting from Monday, the booster shot campaign has been expanded to everybody over the age of 50 and including 50. So booster shots will become available to those in their 50s, people with underlying conditions, and people working in essential services who were fully vaccinated at least 6 months ago. South Korean Health Minister Kwon Duk-chul is actually part of this vaccination campaign. He will be eligible for the shot starting Monday. So he's actually receiving his third jab this afternoon. Registration for boosters began last month, but if anyone decides to get the jab at the last minute, surplus vaccines can also be booked at vaccination centers across the nation.
Right, Yeon-SEUNG, that is good to know. Well, thank you for now, but do stay for the extended talk.